Thank you, Governor. Good afternoon. We're reporting 160 new cases of COVID-19 as of today, which brings the total number of people confirmed in South Carolina to 6,258. Unfortunately, today we're also reporting 12 additional COVID-19 related deaths, and this brings the total number of people who have died and have also had a COVID-19 infection to 256. As you know, we have asked South Carolinians to make great sacrifices through social distancing, closures, and other methods to reduce the spread of COVID-19. And the steps we are taking collectively have been working. We're continuing to provide the most current data about COVID-19 in our state, and we'll consult daily with our state partners to offer guidance based on that data, as well as federal recommendations with the Centers for Disease Control and Prevention. And our data indicate that South Carolina's COVID-19 curve appears to be beginning to level. However, the number of positive cases, while it's plateauing, we're going to continue to monitor that. We don't know what the upper level of the curve is, and we do know that many who are infected are not yet being tested. And I know that many are waiting for a time that we can fully loosen all restrictions, and so am I. And there's really no set time that I can give or a date that is a magic number at which time we can give that full loosening of restrictions. Public health data and other factors will help drive these decisions that are very difficult. And in public health, we will continue to monitor to help follow a measured approach towards relaxing these restrictions. And it's critical that everyone continues to follow the recommendations and the guidance to protect ourselves and to prevent spread in the community. And it's also critical that we intensify our efforts to decrease ongoing transmission, and to do that we're focusing on two key areas. That is enhancing testing in the community as a whole and in areas of increased risk for ongoing transmission in group settings, and that we're also going to enhance our efforts to conduct contact tracing for contacts to illness. DHEC and its partners across the state are working on a plan to enhance testing, and particularly in areas where people are underserved or have a lack of access to care. This means that we'll need to increase our contact tracing, and contact tracing involves identifying all of the positive cases, interviewing those cases, and finding out who they have had close direct contact with, so that we can then notify those individuals of the measures that they need to take to monitor for illness and to prevent additional spread from individuals who have been contacts of known cases. This extensive contact tracing process helps cut short the transmission of disease in our communities. And as part of our COVID-19 response, we have actually surged our number of contact tracers from approximately 20 to over 200 who can help with that effort. An additional point is that the elderly and African Americans are being disproportionately impacted by COVID-19 complications. The reason that African Americans are disproportionately impacted is because they also suffer from a disproportionate effect of cardiovascular disease, chronic lung disease like asthma, diabetes, hypertension, and other issues. And so it is the health disparity that has chronically existed that puts African Americans at higher risk of also suffering complications from COVID-19 infections. And we therefore recognize that there's a critical need to address these inequities. And to reach communities at higher risk, we are collaborating with our state and local partners, including local churches, housing authorities, the State Office of Minority Affairs, and the Office of Aging, as well as healthcare providers who currently serve these communities. And while we've been working to enhance our outreach efforts, we need to do more. And we are exploring new ways to reach these high-risk groups, including those partnerships that I've just mentioned, and also working to create more medical homes to provide services so that those chronic conditions can be better controlled with access to care. In addition to testing, the steps to stop the spread of disease and to flatten the curve are those that we always mention, and that is to practice all the protective measures in the community, to wear masks when you're in public, to social distance, to avoid large groups, to limit public activities unless necessary as much as possible, to observe good hygiene, and those are all measures that we will continue to reinforce to reduce the risk of exposure and ongoing infections in the state.